The New Jersey Center for Tourette Syndrome and Associated Disorders, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. Now, I'm going to turn over the introductions of our speaker to Martha Butterfield, the webinar coordinator of NJCTS. Marty?
Thanks, Kelly, and good evening, everyone. Welcome to tonight's webinar. Before I introduce tonight's presenter, I'd like to call your attention to the slide on your screen about our upcoming walk for Tourette syndrome this Saturday, November 12th in Ridgefield Park, New Jersey. I know that a good number of those listening tonight are not local to this area. So if you cannot attend the event on Saturday, I hope you will log on to our website and make a donation in support of our educational programming. Now to the introduction of tonight's presenter, Dr. Lori Rockmore. Dr. Rockmore received her doctoral degree from Pace University in the area of school clinical child psychology and completed her dissertation on the phenomena of rage reactions in children and adolescents with TS. She served as the clinical director of the Tourette Syndrome program at the Graduate School of Applied and Professional Psychology at Rutgers University from 2005 until 2013 and remains close to the program by acting as a program consultant. This is Dr. Rockmore's second appearance in our webinar series. She previously presented in October of 2008 while she was director of the TS Clinic. Her topic was mental health treatments for individuals with TS. That webinar, along with all of our webinars, are available for download on our website. Dr. Rockmore is currently a partner at Specialized Psychological Services, a group of private practice in Short Hills, New Jersey. Her clinical work focuses on evidence-based cognitive behavioral therapy for tic disorders, body-focused repetitive behaviors, a full range of anxiety disorders, depression, rage, and adjustment issues related to chronic medical conditions. Dr. Rockmore, welcome back. And now, without further introduction, I'll turn tonight's program over to you.
Thank you, Marty. I just want to make sure that everyone is seeing my screen. It didn't do what I thought it was going to do. So Marty or Kelly, could you just let me know that it's showing?
It's showing and you're doing just fine.
Great. All right. I am not the technical expert over here, so I don't know these computers all that well, so forgive me for that. But I just do want to welcome everyone for joining me tonight. This is a little late in my day, so I hope that I could, keep my pep going. And we're here tonight to really talk about disclosure and what to say and how to say it. And what we mean by disclosure is what to do after a professional has given you a diagnosis about a mental health condition. Or this could be applicable to other conditions as well. So basically, what do you do after you've gotten the diagnosis, and how do you tell your child, tell the siblings, and how to tell the family? There will be a second part to this presentation that will be presented by one of my colleagues, Dr. Zambrano, in a couple of weeks, and he'll be talking about disclosure beyond the immediate family, to the schools, to other organizations. And I should mention that I'm a psychologist, a clinical psychologist in private practice, but I am also a parent of 3 young children. So I do see this on the side of both the mental health professional, which I do have to give diagnoses very frequently to families and to children, but also I am a parent and have 3 young children myself. Okay. Not going. There we go. All right, so what I usually like to tell parents is that after you've gotten a diagnosis of a mental health condition, is that it's very important to take time to process the information that has just been given to you. So basically what we really want to do is we want to take time to, to listen to what the clinician has to say and to be able to move past the emotional reaction that we first have when we are given a diagnosis. A lot of times when we get information about our children that isn't expected or is, a little bit different than what we'd hoped for our kids, it does come as a shock to us, and it does come a little, emotionally, it hits us a little bit emotionally, and we need some time to adjust. So, so really what I like to tell parents to do is to just to take some time to digest the information that they were just given. So we have that emotional reaction that we get when we get this diagnosis, and that leads to thoughts about how we perceive our children, and that maybe that those perceptions may have to change with this new information that we're getting about them. So we want to, take some time and to let that sink in and to look at our kids, get that diagnosis and look at our kids, and they are the same kids that we saw before we even got the diagnosis. So we need to, see them functioning on their daily basis and try to integrate this new information into how we perceive our kids. So it leads to sort of a recognition that our child has had this disorder actually probably for a little bit of time, and it gives you time to get all the information together. So you want to be able to get enough information so that you're comfortable with the diagnosis and being able to answer questions and speak about it in a coherent manner. So, sorry, I went too fast. So we really want to be able to let our thoughts become less emotional and more rational after we're given this diagnosis. And basically, once we can think of your child and their diagnosis in an emotional yet a rational way, that's the time when we want to start, thinking about telling our kids. So one parent said to me actually after we went through this process together and they were ready to tell their child about their diagnosis. This happened to have been a Tourette syndrome young child. The parent said to me, it's taken me some time to really, process this, but right now I know, and in quotes, I love my child and my child has Tourette syndrome, and that I will do whatever I can to help them love themselves the way that they are. So, and that means, with their tics and with their other comorbidities, but also with all their strengths that they have as well. So at that point, it really became very clear that that parent was able to, integrate the emotional reaction and the logical, rational sort of way of thinking about it, and was ready to move on to start talking to her child. Okay. So then it becomes a decision, and the conversation that usually happens in my office is to tell the child or not, and what are the pros and cons of both. And what I'm going to advocate for here tonight is that eventually all children should be told in an age-appropriate manner about their diagnoses. It's very important for children to understand the whole picture of who they are. Children are a whole bunch of things, and this is just one small part of who a child is. Learning about the diagnosis, learning about why they are doing the things that they're doing. So a child who's having a very hard time focusing on their schoolwork, a child who is getting frustrated very easily, a child who has a difficult time focusing and attending and is very fidgety in their seat at school. Getting a diagnosis or telling them that they have an attention deficit disorder and that's the reason why they are having these difficulties sort of normalizes their experience for them, lets them know that they are not different, lets them know that they are, that they have something that other people have as well. It really is important to tell all children at some point in their lives. And we'll talk a little bit about this in a little while. Another thing is that children often ask questions. I had a little boy in my office right before this this talk, and he was, asking, why his body makes these movements. And we talked about, about tics, and we talked about, sort of how they happen in the process, and we really got into the nitty-gritty because he was very interested and asked a lot of questions. And, the parents had already told him that he has Tourette syndrome. But, when children are asking questions about their symptoms, that means that they're pretty much ready to hear the name of the condition and what that condition means for them. For this little boy, it doesn't mean all that much, but he wants to learn how to have better control over his symptoms. And that's why one of the reasons why his parents brought him to see me, is to learn better management strategies for these movements that are just causing him a little bit of discomfort. But these questions happened even before the parents gave him the diagnosis, because the parents weren't even sure themselves. So they've come a nice way with all of this. Okay. Sorry, just trying to advance the slide here. Okay, so after we tell the child, we talk about whether to tell the extended family or not. So do we want to, tell every family member that our child has a diagnosed mental health condition? Probably not. However, I think, it is important to, to tell those family members that do have a lot of contact with your child. So, the aunts and uncles and grandparents who are around your child for family occasions and for different, holidays and on the weekends, it's important because, or if they're babysitting for your child, it's important for them to know, because they're going to notice things, and if you tell them, then they come at it like, oh, that's what, that's what they told me. And they, and they're able to interact with the child in a very free and free and normal manner. It's just, it allows like a very, a more relaxed atmosphere when the family is in the know of what's going on with your child. And it also lets the child feel a lot more known. The example of, a family going out and running, doing some, like a jog together, and one child is sitting out. We want the rest of the family to know that Johnny has, exercise-induced asthma. We don't want them thinking that he's just not wanting to participate with the rest of the family. So the perception about the child changes tremendously when they are in the know versus left out of that information. So here, telling the extended family should be done based upon level of exposure to the affected child. So the next thing is to, are we going to tell the siblings or not? So, the thing is that siblings do start to ask questions. And telling the siblings really does lead to a better relationship between the siblings. And I love this like sort of picture, because it's two siblings working together very, very nicely on, it looks like, schoolwork. It looks like the boy is helping the girl, and he's, they look very engaged. And usually this happens when, when siblings do understand each other. And, I had an example of a family that I work with and that was in today as well. It was nice for me to be in the office today because I got a lot of examples to use for this talk. But, the mother was talking about how she remembers explaining to this young man's siblings about his ADHD. And she remembers, the siblings asking, why Chris does, does these things. Why can't he sit in one place? Why is he always, sort of not finishing his dinner? And why is he allowed to get up from the dinner table when they are not? Why is he, sort of getting to, getting tutors to help him with his work? Why, like, they had all these questions. So the mom really remembers sitting down with these two siblings, Chris's siblings, and asking, and them asking all these questions, and then, once the mom told the siblings about the ADHD diagnosis, how it made so much more sense, and their relationship between the three siblings really did increase. The positive relationship, I should say, did tend to increase because they understood and they weren't so angry anymore about all the special attention that Chris was getting in the house. And just so you know, when I use any examples in this talk, I am not using the real names of the child, and I'm also, sort of changing the information a little bit to keep the anonymity of the family and the child in question. So just wanted to state that. But so the mother was very clear today, telling me how she saw such a positive effect after just sharing this information with the siblings. And I have to say that these three young siblings, they're not young anymore. They are pretty much in their adult years. They do get along very, very well, and it's a very respectful relationship, which is nice to see. Oops, blank slide, sorry. Okay, so basically all that we're talking about is that how, and I use this saying a lot, is that knowledge and information is power. If we are able to, if we have information about things, if we have information about symptoms, if we have information about the child who is having difficulty concentrating, or the child who's repetitively touching things, or repetitively shutting off lights, or checking things, like such as an OCD, the child who is, a slow processor, who has a very difficult time learning new information. If we know what that is due to, if we know, what is going on with that individual, if we have that information, we can then intervene, and we could see that child as somebody that we can help, as opposed to someone that we get angry with. So knowledge and information really is power to do right by our children and to give them what they need to help them in their individuality. So I do say this statement an awful lot, and I think that it is really very, very powerful. Okay, so to talk a little bit about the impact on the child's self-esteem. We do see that once we tell the child about their diagnosis, that it actually is a very positive effect on their self-esteem. So let's see what I have here. So what I have here is just how it helps children understand better who they are. So they understand that, they are individuals, that they are, that they are somebody who has tics, but they are also somebody who's a really amazing artist. They are somebody who pulls out their hair, but they're also somebody who is an amazing friend and has a huge group of friends and is a very big leader in their peer group. So it really helps them understand a piece of who they are that they may have not understood before. So I do think that, if we understand ourselves and we don't, we're not in confusion about certain aspects of ourselves, it does increase an individual's self-esteem and the way, the view that they have of themselves. So the thing is that, a lot of times, families come in and children already know that there's something going on with them. They know that they're doing these things that other kids don't do. They know that they're caught up in their heads sometimes and can't get out of their heads. So they know already that something is going on, and when we give them a diagnosis, when we give them a label, it normalizes it for them. It allows them to feel like, oh, if there's a name for this, then it's not something that's so outrageous. It's not something that nobody's ever heard of before. So it really does decrease shame and increases self-esteem. The other thing that we need to, that by telling kids, is that it really helps with the fact that today's day in society, there's so much social media out there. And kids do their own research. I mean, my kids are on the computer researching things starting at, 5, 6 years of age. They have questions. We go on the computer, we get the answers. That's what we teach our kids to do. So a lot of kids start doing their own research before we even are able to give them a diagnosis. And we want to make sure that they have the correct information, because in social media and on the web, there is a lot of incorrect and scary information. So by telling them what the diagnosis is and sort of being very clear with them about what's going on with them, it really takes away that fear that sort of gets promoted within social media and on the web. So I think that, we have to realize that all of our kids are probably doing their own research, and we need to be able to be the ones that are giving them that information, not the web. The other thing is that, children realize when you tell them that they have a diagnosed mental health condition, that other people have this diagnosis too. If there's a name for it, that other people have it as well. And what I always like to tell parents to do is to really research famous people that that have the same diagnosis as their child. that it's really powerful to hear about Tim Howard having Tourette syndrome. It's really powerful about hearing other people in theater and in the movie industry who have ADHD and who have, OCD. It's really powerful for them to hear that. And on the same vein as that, which I was talking about, I think, when I was with Kelly and Marty, actually, is that it's really helpful for kids to know if one of their parents have this same condition. It does help the child and raises their self-esteem to know that a parent that they really look up to, or a parent who, they may admire, who's a very, they successful in their eyes, has a similar condition, and that they've been successful as well. So telling a child about their diagnosed mental health condition helps them understand better who they are in a number of ways, but also helps them see that this is not something that they need, that's going to hold them back in their lives. It doesn't have to be something that holds them back. And that's a message that we want to really convey to them when we are discussing their condition, that this is something that other people have, that it is, it is one piece of who you are, that other people have it too, and they've been really, really successful with this condition, and that means that they can be successful as well. We may have to help them with, certain modifications or different ways of doing certain things, but that doesn't matter. We all learn differently, and we all, respond differently to different things. And knowing this diagnosis really helps us know the child better, and helps us educate them better in the school systems, helps them better interact with their peers, and helps them to be known in their family and in the world itself. So, if I haven't, driven this point home enough, I really only see it having a positive effect on the child's self-esteem. So I'd like to talk for a few minutes about the negative impact of not disclosing this information to your child. The big thing really is that it leads to a sort of a family environment of distrust and strains family relationships. Because like I said before, kids do their own research. And kids know when there's something going on with them that doesn't seem right. I've had adults come into me and say, I just knew something was wrong with me. I just knew that there was something that was holding me back. And as they got to be adults, they went and investigated it themselves, and they found out they had ADHD, or they found out that they had a learning disability. And so in today's day and age, it doesn't have to wait till then, because kids start doing that research, very early on. But kids know that there's something going on. They know they're learning differently than their peers. They know that their bodies are doing things that that other people's bodies are not doing. They know when people say to them, "Why are you blinking your eyes in that kind of way?" So really, everyone who comes into my office, we do a very good job of talking about why it's important to talk to your children about their diagnosis. A lot of parents don't want to use labels and don't want to name these things sometimes, and that is one thing that we do talk about. And we'll talk about that a little bit more, I think, in a slide or two after this. But I just want to also drive home that I have not seen one good instance in where we should hold back this information. Maybe it's not the right time, and we always talk about timing of, discussing the diagnosis, but the thing is that at some point in the child's life, it really is, I can't think of one instance, like I said, of not disclosing. I feel like I want to ask, does anyone have questions? So it's just like so innate in me. But I will move on and get over that. Okay, so next. Okay. So basically what I'd like to talk a little bit about is some of the things that have come up in my office about barriers to parental disclosure, and about the reasons why some parents don't want to disclose. And if these are barriers for you, that I suggest that you do discuss them with the people who are working with your family, pediatricians, neurologists, psychiatrists, mental health clinicians, even spouses or religious sort of clergy. But really, if something is holding you back from disclosing this information or talking about this information with your child, it's important to get some help with that. But these are some of the barriers that, that I've found. So some parents have a difficult time understanding the information. Either that it's just so foreign to them that they've never heard of this term before, such as ADHD, Tourette's, generalized anxiety, a specific phobia, PT, post-traumatic stress disorder. Some parents have never heard of these terms before. So sometimes it's the first time hearing it and they need to really understand it very well. And it takes some time. The other thing is, like we talked about at the beginning, is that sometimes it's a very emotional reaction that we have to hearing this information. So sometimes our emotions sort of interfere with our ability to understand things from a logical and in a clear way. So really what we need to do is, help, as us as clinicians, we need to help the parents understand the information as clearly as possible. Another barrier is, like I said, the information being too emotionally upsetting for the individual, and sometimes it takes a while for the parents for this information to sink in, for them to move from the purely emotional standpoint to the more rational, mixed with the emotional kind of standpoint of looking at this diagnosis. A lot of times what I've seen is that families, after they get the diagnosis, they just need to be with their kid for a little while. They need to go back home. They need to see their kid and realize it's the same kid that it was before they got the diagnosis. And they need to see the kid interacting in their life and the struggles that they were having that brought them to the clinician's office, and the strengths that they have, they're still there. The struggles are still there. The strengths are still there. So once there's some time and they have time to digest the information, it becomes less emotionally upsetting. And the more information that they get, the more rational information about the course and the prognosis and the specifics about intervention, then they start to move away from the emotional and really get into that balanced perspective of rational and emotional kind of ways of seeing it. Another thing is that, a lot of parents may say to me, like, what do I say? Like, how do I explain this to my child? I don't even get this kind of thing. So we have to sort of talk about, and sometimes I give scripts, and sometimes we role play, and sometimes we, we really, we role play different questions that they think the child may have. And to be honest with you, every time I've done that, it usually goes a lot easier than the parents expect, because once they've practiced enough and they've asked all their questions and got answers and they feel comfortable with their script, a lot of times they get rid of the script and they just have a natural conversation with their child, and it goes better than they expect. So there are a lot of things that we can do to help parents, explain it to their children in a way that is logical and that is helpful for the child. Oops. Okay, so just to go back for a second, I think those are, pretty much what I've seen in my office. And like I said, in my office, we do work through all these three situations with the families and the parents before they disclose to their child. And for the family, I have had a couple of families that really wanted my support in doing this, and we've actually had family sessions where we've disclosed the information to the child, and I think it goes well that way as well. It's all about a parent's preference. Okay. So the overall goal of disclosing the diagnosis to a child for me is to help the child accept and normalize it. Really, we want the child to, to just see it as one part of who they are, to see the symptoms and the diagnosis as a very small part of the bigger picture of who they are as a person, and to know that this is something that other people have, and that if they want to, speak to other people who have it, that's available, and that it is, that there are probably other kids in their school that have it as well. And if we paid attention, I'm sure you could see it. So again, it's really the acceptance piece, normalization piece, and that really leads to a child with, a positive sense of self-esteem. Okay, so let's talk about when disclosing a diagnosis to a child, what to consider. All right, so we want to consider that the conversation is age appropriate. That's definitely important. So you're gonna, when you talk to a child who is of, 4, 5, 6 years of age, that conversation is going to be very different than talking to a child of 11, 12, 13 years of age. And that conversation looks even more different when you are disclosing to a 16, 17, 18-year-old child. So really, I mean, I think the conversations need to be changed according to the age of the child. And then there are some very precocious younger children. So you just need to be careful that even if your child is precocious and does seem a lot more wiser than their age, to still keep it age appropriate to their age and not their intellectual ability, because it's sometimes, kids who are intellectually bright in school emotionally sometimes are not at the same level. So I do say to keep it age appropriate, not intellectually age appropriate, if that makes sense, hopefully. The information that we give children should be truthful, honest, and knowledgeable. And one of the biggest things that I get this a lot with families, who have Tourette syndrome, is that a lot of families, sort of hold back little pieces of information, about the waxing and waning profile of the disorder, or that it's a possibility that tics could, persist, in adulthood. It's a possibility. It's a low probability. But you don't want to be telling them information that is going to come back and they're going to say, but you told me this and it wasn't true. Whenever you're disclosing information to the child, you want to make sure that they're not going to come back and be angry at you for saying something that was not truthful. Now listen, we sometimes, learn new things, there's new research and new information comes out later in life, and that's what we, that may be a reason, that you're not giving this information when they're younger because it hasn't been found out yet, but that's a different example and that's a different situation than withholding or not being truthful and honest about the information that we know now. So, so it is very important when we are disclosing this information that we be truthful, honest, and knowledgeable to the best of our ability. The other thing that I always tell parents, and I use this rule as a clinician, is that it's okay to say that you don't know if you truly don't know an answer to one of their questions. So it's a possibility that they may say something and you may be prepared as ever for this conversation, but you may not have an answer. But the thing is that we can always find out the answer to those questions. And when they ask that, it's a good sort of jumping off point for you to say, listen, I don't know everything and I'm not an expert on this yet, but I'm hoping that you and I together could become experts, and that, experts, when they don't know something, they know who to ask. And that, there are ways to find out this information, and we're going to research it together. So the next time we have an appointment with the doctor, or maybe you could send an email to the doctor, or maybe we could look online at some of our parent resources, and we'll talk about some of those resources at the end. So there's always a way to find out the answers to the questions, and it's a good way to start being a team together with your child to answer questions that you don't know. Because it's important for both of you to know the answers to those questions, as the parent and also as the child. So, so those are a number of things that that I ask parents to consider. Okay, so now we're going to talk a little bit about how to tell the child. And the words that I like to use are: we tell the child in an honest way, in a supportive way, non-judgmentally, reassuringly, normalizing it, and then also in a simple way. One thing that we tend to do when we're anxious is that we say too much. We just talk and talk and talk because we're not comfortable with the information. So that's why I always tell parents, like we started off this talk with tonight, about taking the time to process the information. Once you've processed the information, you should be able to talk to them in a simple way that is not too wordy and not too confusing for the child. So I'm just going to give an example of sort of something that I might say, how I might say to a child that they've been diagnosed with with Tourette syndrome. So, just so you guys could have an example of how I might say it. So I might say to a child, you know those movements and sounds you've been telling your dad and I about, and how you say that you can't control them? Well, the good news is that we finally found out what they are called. Remember when we went to see Dr. Rockmore? Well, Dr. Rockmore is an expert in these types of movements and sounds that kids can't control. And she actually said that those movements and sounds are called tics. It's funny because I know that there's a bug called a tick, but this is a different. It's not the bug, it's a tick, and a movement or a sound that we cannot control is actually called a tick. And they actually, if you have tics that are with movements and with sounds, sounds that you can control and movements that you can control, they actually have a name. And that name is called Tourette syndrome. So that is one way how I might tell a child about their diagnosis of Tourette syndrome. Okay, when do we tell a child? We can tell them once the diagnosed mental health condition has been identified. We can tell them based upon the child's level of maturity. When the child begins to ask questions. When problems start to emerge. Sometimes parents say, why should I tell them if it's not impacting their lives at all? This diagnosis doesn't mean anything to my child at this point in time, so I'm okay with that. But if the child starts asking questions or problems start emerging, then I say, then we need to tell. And at some point, as the child gets older, if they are really maturing and moving towards the point of leaving the house and there's never been a problem with the tics, or they've never asked a single question, which in my experience, and I've been doing this for a while, has never occurred, then I could see maybe that's a reason when you wouldn't have to tell the child. But then there are, sort of genetic sort of ramifications of that. So I just don't think that there's ever going to be a time when a child is not going to have a question or a problem is not going to emerge based upon a diagnosed mental health condition. Because part of our criteria for diagnosing a condition typically is, except for Tourette syndrome, it's the only exception in our book, is functional impairment. So to be diagnosed with ADHD, with OCD, with generalized anxiety, or any other mental health condition, there needs to be functional impairment. So, so the thing is that typically we are always having some difficulties when a diagnosed condition is made, and that's when we should tell the child. Okay, so what do we tell the child? And we'll go through a couple of bullet points, and then I'll give you an example of something that I might tell the child. So what we want to convey is that we are all different. Everybody's different. We all have we all have different color hair. We all have different color eyes. Our skin complexions are all different. Everybody is different. Some people have food allergies. Some have diabetes. Some have, some have short stature. Some have, thumbs that are different sizes. My sister has one toe that's longer than the other, which is something that is definitely, we always joke about that makes her different. We all have things that make us unique, individual, and different, and that's one of the things that we want to say. That help is available if needed. Having this diagnosis really does guide us into the type of help that a child may need, and that there are many options for treatment. So, so that is something that's very reassuring for children to hear, is that there are things that can be done to relieve some of their discomfort or their struggles if they are having any. So we want to let them know about that when we're telling them. That strengths will help them overcome any challenges faced. So we want to be able to tell them that, that they have this, but they also have so many other strengths, whether they are an artist, an athlete, whether they are an amazingly kind and empathetic individual, whether they are a leader, whether they are, intellectually just, really bright and they read and have like a quest for knowledge. So we want to be able to couch, the diagnosis within their strengths and make it into the whole picture and not just one piece of who they are. I think that's really important, and I've seen that be extremely helpful to a lot of kids. To let them know that there are other people with the same condition, which we've talked about before, parents, celebrities, things like that, that the condition is not fatal. You know, a lot of kids worry, especially kids who are a little anxiety-ridden, that this means that they have something that could be fatal. I've had kids come in who, you know, have obsessive thoughts and they can't stop thinking about certain things and they think that they have a brain tumor. So sometimes, because when you know, put into Wikipedia, you know, racing thoughts or not able to keep your mind on something or attentional problems, one of the things that does come up is brain tumor. So we want to be able to reassure them that this is nothing fatal and this is something that, you know, other people have, and this is something that has treatment options, and this is something that, you know, your strengths will help you overcome. So it's important to give them that information. That having this condition is really no one's fault, that we're all sort of, you know, we're just a product of what goes, you know, of our environment and our genes, and we, you know, some things get expressed sometimes and some things they don't. You know, my mom had brown eyes and my dad has blue eyes, and I happen to come out with green eyes, you know. So it's really, it's no one's fault. We sort of are born with what we're born with, and things get expressed or they don't get expressed, and we just have to move forward, and we have to, you know, we have to get help if we need help. We have to examine our strengths and really focus on those, and we have to realize that there are other people with the same condition and that we're not gonna, you know, we don't have anything that's fatal, and we're gonna move forward, and we're gonna do the best that we can and get the help that is needed if we need it. All right, I think, okay. And the other thing is to what they can expect in terms of their symptoms. And we want to encourage the child to ask questions now and on an ongoing basis. So those are the, you know, what I think is important to convey when we're talking to a child about a diagnosed mental health condition. So now I'll give you an example of something that I've said, and we'll go from there. All right, so what I say is everyone is different. We all have different color hair, eyes, and skin. We also have different smiles and ways of responding when asked a question. No two people are exactly alike. Some kids have allergies, some kids need glasses, some kids have diabetes and can't eat things with a lot of sugar. One of the things that makes you John is your tics. It's one of those things that we, you know, that we love. It's a part of who you are. We love the whole package. Listen, your dad and I think you have so many strengths and positive qualities that outshine your tics, and you know, we see those so much more than these tics. You're such a kind and considerate person, a great friend, and an amazing sibling to your brother and sister. You excel at science and technology, and you're able to fix most things in the house, and you're such a help to us in that way. We want you to know that there are a lot of other kids that have tics too. And if you're ever interested in meeting another kid or kids with tics, please let us know, and we can make that happen. Please, we want you to ask us any questions you have about your tics or anything else now and whenever. We are here for you and love you and are here to help in the best way we can. And if we don't have the answers, John, we will try to find the answers together. I promise. We're a team on this, and we're going to get through this together. So that is what I would say, you know, in those, you know, when we're discussing the diagnosis. So what parents sometimes say to me is that there are certain fears that they have. And they worry about, you know, that when the child learns about the diagnosis, that they may make the child feel different or affect his or her self-esteem. Hopefully, this talk tonight has shown you the opposite of that really the diagnosis only positively affects a child's self-esteem and really helps them feel much more understood. It makes them, you know, put themselves in a full picture. They feel that they have a piece of information about themselves that they didn't have before. And if they could understand themselves better, that positively affects their self-esteem. So, and in my experience, the real truth is that once children are told about this diagnosis, they most definitely feel a sense of relief. It's you know, I've seen kids time after time take such a huge breath of relief once their parents tell them this information. And I've gotten thanked numerous times for, you know, for really helping them, you know, understand what's going on with them. So it really, it really is a very positive thing. I can't stress that enough. Most children feel relieved knowing that there are other kids out there who have the same diagnosis. And like I said, has a very positive influence on their self-esteem. Okay. All right, so right now I'm just going to go over a couple of resources that you can use for more information. So if you do have questions or need additional information about any of the conditions, mental health conditions that I've spoken about, they are here. So the places to get them are really through your local pediatricians. Through national organizations such as the NJCTS, who's sponsoring this webinar tonight, the Tourette Association of America, the International OCD Foundation, CHAD, which is Children and Adults with ADHD, Attention Deficit Hyperactive Disorder, and the Anxiety Disorders Association of America. Those are the organizations, the national organizations for the disorders that we've spoken about today. But again, if a disorder is not listed on this list, you could always ask your pediatrician, and they should have the resources for the association that supports the specific condition you're struggling with or your child's struggling with. And most of these national organizations do have state chapters. So a lot of times the state chapters run local support groups, or they have physician referral lists. So a lot of times these organizations, and specifically the state chapters, could help you find resources and support services within your specific state. And the other source of information really should be your local mental health providers. So, getting resources or referrals from your pediatrician. Most of the times the pediatricians do know of the local mental health providers. Sometimes the school districts as well will have, sort of lists of mental health providers that they work with on a regular basis. So that's another way to get information to answer some of the questions or get support if support is needed. So at this point, this is my contact information. I am available if you have questions beyond the week of where I'm answering questions specifically related to the webinar. But I'd be more than happy to help you if I can, or if I could point you in the right direction. But the NJCTS really is an amazing resource, and I would highly suggest that you either reach out to them or to me, and we'd be more than happy to do whatever we can to ease your questions or concerns about, disclosing a diagnosis to your child or to the family or siblings. And like I said, Dr. Zambrano, in a couple of weeks, we'll be talking about disclosing information beyond the family to the community and to schools and the workplace. And I'm excited to hear what he has to say about that. So I thank you for your attention, and I am going to turn everything over back to Kelly.
Well, I think you got Marty instead of Kelly, but that's okay.
Okay.
No problem there. Dr. Rockmore, thank you. A lot of great information there. So I'm going to jump right into some questions, and we had a couple of questions about the scripts. So
Okay.
I'm going to ask you a couple things as it relates to that, and one of them has to do with whether or not you would be willing to share some of the scripts. I know you spoke and you shared some of that information as part of the webinar, but is that something that you've put together in any kind of a
Can you tell that I was actually reading it?
Right.
Yes, I could share it. It was like when I thought about just doing it ad lib, but I wanted to make sure everything was in there, and it's different when you're in a room with the person and there's that sort of dialogue and the rapport going. So I did write it out, and I'd be more than happy to share with anybody who is interested. So I could forward that piece of paper to you, Marty.
Okay, that'd be great. And along that same line, this was a question from an education professional, and she's saying that she's not sure she would know how to adequately explain TS, for example, to different age groups, and more specifically, how to discuss the cause of TS. So could you talk about that a little bit?
Okay. I think TS is, again, it's a diagnosis that, mental, that the provider really, like I consider myself an expert in TS, so I know how to sort of talk to the children about it. It's something that I think you need to feel confident in the information yourself before you give that information to anybody else. But the thing is that, and then for the different developmental ages, a younger child, you really want to be very concrete and specific. You want to give them information that is at their age level. So a younger child really, they don't look to the future. A younger child is not future oriented, where, someone in high school is future oriented. So you might talk with a teenager, a high school student, more about, their future, because that's going to be questions that they're going to have. A younger child, you're not going to do that as much. A younger child, you're going to talk to them about the things that you can do to help them if they're having certain, concerns, and you want to know what their concerns are. So you really want to, just look at like developmental sort of things. The middle schooler very often wants to know, what do I say to my friends? They're very concerned about, their world and their social world. So, I think we have to, number one, understand the different developmental needs of children at different ages. And I really lump them into like, elementary age, middle school age, and, high school, college age. And then, at the same time is, sort of formulating what you say to them in a way that relates to their specific concerns at their developmental stage. Related to what causes TS, what I say is that it's this is the textbook answer, is that it's a neurobiological condition. So we know that there's some genetic susceptibility. So we know that, that it is passed down from family to family. It doesn't mean that your family has had tics. It could mean that they have had anxiety. They could have had some attentional issues. So not every parent of a child with TS has tics, but somewhere in there, if you trace back their genetic history, you could find it somewhere there. So I usually explain to them it's something that we're born with, and sometimes it comes out and sometimes it doesn't. And we don't know what brings it out and what doesn't bring it out, but we have a lot of people that are very interested in that information. And we have researchers out there that are studying all this and trying to figure it out. And that's where I try to get some of the kids interested in, like, doing participating in the DNA repository and in some of the other research studies, because kids are, they want to help. They want to, help with the information that's learned, that they learn about this condition. So I think that, with kids, I really tell them that it's something you're born with. And it's something that comes out, and we don't know what brings it out. But, and then with adolescents, I would talk a little bit more about it. I'd use the words genetics probably. With younger children, something that they're born with. And just like they're born with, their hair color, their eye color, their skin complexion, we're all born with a set of information that gets expressed in how we look, feel, and act. So that's pretty much my spiel on that. Did I leave anything out?
No, I think you've covered that really well. But it is interesting, though, you mentioned the repository, and I think that's a positive thing because because kids, again, we're talking about TS now, but kids get to, and family members get to actually participate in something that could lead to an end, could lead to a cure, could lead to more information. So you get to do something that's positive there versus
so it does. It really helps. It really helps the kids sort of feel like they are, that they have some control. They're adding to the knowledge and the wealth of information that we have about this condition. And the kids, it's the smiles on their faces, and their, how good they feel about themselves after that. And they always want to know. They always ask me, is there anything that they learned new? Tell me, is there anything new? I want to know. What did my blood help them with? They're very excited about that. So
I can appreciate that. To the end, about what you mentioned something about role models in your presentation. So the question is that we have a child. They don't say, with TS, don't say how old the child is. But the dad does not want to be considered a role model because he doesn't want to admit that he had TS as a child. So would appreciate your comments on that.
Okay, that is a tricky one. So does the dad have, I mean, my question would be, does the dad have any symptoms as an adult? You don't know that?
Don't know that, no.
Okay.
But
Um,
I would suspect that probably not anything that the child's noticed, you
right.
know, to any extent. So probably just real simple, you know, things that are really not standing out.
Right. So, I mean, listen, I understand and I could sympathize and empathize with the father's perspective. And you have a right, I mean, you have a right to your privacy. If you want to keep that private, that is your right. However, if you were working in my office, I'd probably, talk to you about your experiences as a child with the tics and try to understand from you what your experience was with it. And if it wasn't such a positive experience, then talking about how today things are very different. And with the knowledge and the information we have in the field of mental health, and specifically around tics, things are very different, and they don't have to be as difficult as they were when you were a child. So I'd want to process with the father what his experience was like, and to explain how it's going to be different for his child, and how really, we could use him as a positive role model, because I'm assuming that this father is, if he's on this webinar tonight, that he's successful in his life, and he's done well for himself, and that if the child sees the father in a positive role as a, as a parent, as a professional, or as a, as a spouse, as a, a father, then in any of those roles, if the child sees the father as a success in any of those roles, then it would be really helpful for the child to know that the father had a similar condition when he was a kid. And, and even if the father has no noticeable symptoms, that is also a good thing for the child to see, that they may be having a difficult time now, but when they're an adult, it's a possibility that they're going to be just like the dad and not going to know that they're, that they have these symptoms. That other people won't see it anymore.
Yeah,
So I
yeah.
think that it's really, it's something that I would definitely, work with the dad on, and hopefully, get him to a point where he would see it as a positive situation to talk to the child, as opposed to not such a positive situation.
Okay, thank you. Would you recommend that children, and this is for elementary age now, children and their parents discuss their diagnosis with classmates? So this, again, doesn't have to be just about TS. It certainly can be one of all of those, any or all of those conditions that you talked about. But would you discuss that a little bit?
Yeah, I think Dr. Zambrano is going to be talking about that further in a couple of weeks. But one thing I could tell you from my personal life is that I have a child who has a peanut allergy. And everybody knows that he has a peanut allergy. And it's only been a very positive situation because it helps keep him safe. And I think that, I do think that, and I've seen the NJCTS does a number of these peer-in services where they go into the classrooms and the schools, and they educate students about TS. The child could either be identified or not identified as a kid with Tourette syndrome. But usually those situations where you go in and educate the classmates, that child experiences such a sense of relief and such a sense of, acceptance and understanding from their peers that I only see it in a positive light. So like I said, knowledge is power, information is power. When you educate kids about why a child is blinking so much, or why a child is, clearing their throat a lot, or why that child has to stand up and, and every now and then has to make a jump, at their seat, they understand why the child is doing it, and they don't misinterpret their behavior as something negative. They understand it in the context of an allergy as a condition, as something that the child it's outside of the child's control.
Right.
So
And
I do believe, yeah, go ahead.
sorry, go ahead. I'm sorry.
Yeah, no, you're good. Go ahead.
But they also then understand in that particular example why the child gets to get away with doing that, standing or doing
Exactly.
whatever it is
Yes,
that
why the
they
child is
need to
not getting
do. Yeah.
reprimanded, or is not having a consequence for that behavior. Right.
Okay, let me just move my screen here. We are going to do one more question, okay?
Okay.
And I just need to find the one I was going to ask. Okay, so how do you deal with the denial or the resistance from family members to a diagnosis of mental illness?
Yeah, it's hard because you know what? A lot of times for me, sitting here, it's painful, and the resistance really is usually an emotional sort of disbelief or an emotional sort of insult, and it hurts. It hurts to see them going through it, and the thing is, from my perspective, is I know that it doesn't have to be so painful, and I see so many families get through it, and they really rise above it, and they really do the right thing for themselves and for their family and their child specifically. So what I tend to do is I give them time. And I schedule another appointment with them in a week, and we check in, whether it's over the phone or whether it's in person. And we take time to process, and I answer all questions. And I really give them that space that they need to digest the information, to take it in, to get further information that they need, to talk to whoever they need to talk to, and eventually they do get through it, and they come out the other side, and we move towards disclosing to the child. So a lot of times it just takes time and space, information, understanding, and a person meeting with a clinician or somebody who has been through this before and can show them and explain to them that they will get through this just like all the other families have as well. So a lot of times, meeting with a clinician who has an expertise in the specific diagnosis that that your child is struggling with can be very helpful because they have a lot of experience with other families. And I think that that is one of the greatest benefits in meeting with a clinician who has an expertise in a specific area. How's that?
Okay, that's good. That works. I
Okay.
think we're going to wrap it up here. I know you've got a busy night still ahead of you.
I
So,
do.
thank you very much, and I'm going to turn this back over to Kelly to finish up.
Okay, thank you.
Thank you.
Have a good night.
You too.
Thanks.
Thanks for joining us on our webinar on disclosure, part 1. There is an exit survey which we need everyone attending to fill out. The webinar blog is now open and available for the next 7 days on the NJCTS website for any additional questions that were not covered in tonight's presentation. The website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to our website. Our next presentation, Your Rights in the Private Schools, is going to be presented by Rebecca Spar and is scheduled for November 16th. This ends tonight's webinar. Our second part of this, Disclosure Part 2, will be on December 7th by Dr. Zambrano. This ends tonight's webinar. Thank you, Dr. Rockmore, for your presentation, and thank you, everyone, for attending. Good night.